Hi, everyone. Thank you for joining us today for a look inside our State of the States Report webinar. I'm really excited to talk about our report today. Just want to let you guys know there is a chat box to the right or a Q&A box on the bottom. If you guys have any questions throughout the presentation, please make sure to post those questions there because we're going to have a Q&A portion at the end of the webinar. And to start the webinar today, we have a wonderful intro from PA State Representative Ed Gainey.
Gainey, State Representative for the 24th Legislative District. And today I'm here to talk about an important issue that impacts the medical cannabis field. One, I want to thank Americans for Safe Access. Because of your hard work, your advocacy, we've been able to do a great thing in helping patients relieve their pain without addiction. I want to thank you for the work that you do. But we still got some work to do. And part of that work is making sure that we have enough retailers throughout this Commonwealth of Pennsylvania that every patient that needs medical cannabis can get it. That's number one. Number two is we have to find a way to reduce the cost. Reducing the cost allows us to serve more patients that are in desperate need of medical cannabis. That's number two. And number three, we also have to continue to fight for adult use. So as you hear this right now, I need you to do me a favor. Call your state representative and your state senator and tell them that we have to close the gap when it comes to medical cannabis, when it comes to making sure that we got more retailers, when it comes to making sure that the cost is going down so that more people can receive medical cannabis, and thirdly, that we advocate the right way for adult use. See, together we can make Pennsylvania a better state, and this is the one way that we can do it. So let's join with Americans for Safe Access. Call your state representatives and state senators and tell them, continue to go to work to make the medical cannabis field a much more protective, less in terms of cost and friendly environment. Thank you.
Thank you so much to Representative Gainey. Is he not amazing? Don't you wish every state legislator could be like that? Thank you so much. So what is the State of the States report? If you're not familiar with our report, this is our 6th report that we've done that assesses legislative and regulatory improvements in medical cannabis programs across the country. This report provides a detailed analysis of the state of medical cannabis programs in 47 states, DC, 4 territories. All on a scale from A to F. So it is a very big report. It takes months and months and months of analysis and research, and everyone on our webinar today was a great help with preparing this report, and we are so excited to talk more about it today. So what we're going to go over today, we're going to do just a quick summary of the report and the top 5 takeaways. So you can find the report at safeaccessnow.org/SOS, or you can find the blog at safeaccessnow.org SOS20_blog if you would like to read that blog. Okay, so the first thing is we want to talk about, we did something new this year. So normally we release the report during the National Cannabis State Legislators Conference. And so this year, that got canceled, unfortunately, due to COVID. So what we decided to do was include, take a little bit more time doing some research for the report and include the COVID responses, state responses in this report. 33 states included COVID responses. And those included use of telehealth, curbside pickup, and delivery. In this year, we have our bonus score was the COVID. And we're going to talk a little bit more about how that reflected in some of the states and their grades. Another big issue was a lot of states moved too quickly to consider adult use before fixing some of the issues in their medical cannabis program. We're talking about patient legal protections, patient access, and product testing and standards and labeling. So we're going to talk a little about those issues. Another big key takeaway was the ongoing cost of medicine. We did a patient feedback survey, and just like last year, almost someone in every single state talked about how they cannot afford this medicine. And then the lack of functionality for patients in the 14 states that are CBD only or CBD with limited THC. So we also analyzed all those states that just have the low CBD. Before we move forward, I want to thank our sponsors, Ease, BASA, Rise, Caniatric, and Canasafe. We cannot do any of our work without the support of our sponsors and members, and so I just want to say a big thank you to them. We are still looking for some sponsors for the printing of our report. Last year, we were able to print hundreds of copies with support of our sponsors. And this year we are looking again for support. This is the report from last year. It's really beautiful when it's printed out. And unfortunately, we can't do that without some financial support. If you're interested in helping us, please reach out to Reenal, R-E-E-N-A-L, at safeaccessnow.org. We'll put that in the chat box so that you can reach out to her if you're interested in helping us get these printed copies out to legislators. So here is a look at some of the graphics in our report. There's two things that I want to point out in this graphic. One is, if you look over to the left, it says 4.4 million medical cannabis patients in the United States. Last year, it was 3 million. So we have 1.4 million new patients just in the last year. And then the other thing I want to point out is in the middle, on the bottom, death overdoses by prescription drugs. That number has actually gone down since last year. It's only about 7,000, but still 7,000 lives is pretty huge. And, you know, is it because of medical cannabis? You know, who can say, but I think it's a telling sign that that number has gone down. If you look over to the right, you'll see our COVID response. As I mentioned, that is our bonus and it's new this year. And the way we scored it this year is if you allowed delivery, if you allowed curbside pickup, if the states deemed cannabis as essential, cannabis business is essential, not just dispensaries, but also cultivators and laboratories, manufacturers, because we wanted to keep the stream of medicine being continued. And did the state allow for telehealth? So because some states already have some of these regulations, we gave the highest scores to states that already had these regulations, because honestly, these regulations were needed even before COVID. So states that already had them got the highest scores. And as you can see, there's different scores there. States that added them due to COVID, whether they were partial, some states kind of did it partially or fully, their scores reflected that. So every state report card has their COVID score on it this year. Okay. Also new to the report, there's a few other things new to the report that you'll see throughout the webinar. We did a % of patient population, the number of dispensaries, number of licensed dispensaries that were active, the ratio of patients to retail location, and then another section, one of my favorite sections that you'll see later on in the webinar, is the gold standard section, which talks about states that really did well in certain categories. And so you'll hear more about that soon. And now I'm gonna hand it over to Dustin McDonald, who is our interim policy director.
Thank you, Debbie. And thank you to everybody for tuning into today's webinar. I'm really pleased that you can join us and take this deep dive in through this year's report. Digging in, this map really illustrates a lot of what Debbie was just describing. Here you see a breakout of all of the states in the country, with specific states highlighted and grouped into different categories representing the level of access they provide. So you see the states that are in yellow, these are your low THC or CBD only states. There are 14 of these states. You see the states in purple. These are states with comprehensive medical programs that have been organized. And you see the states there in blue that have both comprehensive medical as well as adult use models in place. States that appear in gray, of course, there are only 3 of those, have no model in place whatsoever. Also, I think it's important to take a look a little bit at the scoring that we've organized and how that ultimately broke down for states. Here you have a handy key that really shows you what that breakout is in the bottom right. You can see that there's only 1 state that walked away with an A grade, and that was an A-, and that was Oregon. Huge props to Oregon. And then you see there were 14 states that also walked away with an F. These are states that have a lot of trouble in terms of how their programs are serving patients. The bulk of states you see really kind of were captured in the C to B plus range, where you have a lot of states with programs that are built maybe a couple years ago, and they're in the process of providing updates and improvements to those reforms. As we hop into this next section, we're going to take a deeper dive into Asus scoring methodology and talk a little bit about each individual scoring category, and within them, the specific components that ultimately inform a state score. So looking at this slide, this really shows you the total range of categories. So here you can see we grade across patient rights and civil protections against discrimination. Of course, these are things like rights that protect patients in employment in their jobs, ensuring that their participation in the state-sponsored health program and use of cannabis at work doesn't infringe on their job. Same thing with access to medicine. It's a separate scoring category that we dive pretty deep into. Obviously, that we're looking at things like how states are doing with organizing a sufficient number of retail access points for consumers to get to, for patients to get to. This next category, ease of navigation, talks a little bit about some of the same issues as well as ease of navigation within and functionality as well for the state systems themselves. How capable are these systems in enrolling patients and bringing them on board easily? Are those systems easy to navigate? What about physician visits for patient enrollments? Is that an easy process? So you'll see that we break out a pretty deep dive into that scoring. And then the last category, of course, is consumer safety and provider requirements. There, you're looking at a lot of issues like laboratory testing and labeling standards, as well as staff training and whether or not the industry really is prepared to serve patients in the regulations. To give you a deeper sense of how we score, even deeper than that, we'll take a quick look at Florida as a case study. So here you can see on this section, you see a narrative that gives you a sense of what Florida has really done to improve its medical program since we issued this report last year. In the bottom right, you can of course see this year's grade as well as how the state has scored for the past couple of years. So you can see the improvements that the state has or hasn't made. And the top, of course, you can now see the total number of registered patients for each state. Here with Florida, you can see the number that they have, which is about 350,000. And then also, as Debbie mentioned, that's included in this report that's new this year, we have the total number of legal retail access points available for patients in the scoring too. But beyond that, we dive in, as I mentioned, deeply in each one of these categories, from patient rights and civil protections, all the way down to access to medicine, ease of navigation, functionality, and consumer safety and provider requirements. Across each of these, we really just wanted to show you in there. We dive in pretty deep across each category to produce that portion that ultimately informs the final grade of that state, really trying to take into account all the different program features that these states have organized to serve patients. Over the next few slides, we're going to be talking about states' response to COVID, which, as Debbie also mentioned, was a special scoring category in this year's report. States were given a 20-point scoring option that they could achieve some additional points in for this year's report. With 33 states of the 47 with legal access models having organized reforms, there was a lot of diversity of these reforms, but we kind of tried to bucket them into 2 different categories: access and safety, and then state program and ease of navigation and cost. And so we'll jump into access and safety first. But before we do, we just want to take a minute to talk a little bit about the work that ASA did in the lead up to COVID. In March of this year, as the pandemic really took off, it became clear to ASA that there was going to be a challenge potentially to patients if states were not going to be willing to include specific provisions in their COVID response measures that ensured that medical cannabis businesses could stay open, and not just retailers to serve patients at the register, but also businesses all the way through the supply chain, from cultivation and manufacturing to distribution and testing, all the way through retail. These businesses needed to stay open so that patients could have a steady stream and supply of access to medicine. As I mentioned, you had 33 states organize these reforms. ASA worked very hard to organize a working group in the spring to reach out to governor's offices, to reach out to state regulators, to reach out to state lawmakers' offices, encouraging them to keep cannabis businesses open and serve patients, and to really work to try to organize features that keep patients safe during COVID. So we'll talk a little bit about some of those with respect to access and safety. On access and safety, what you really saw here were states organize some reforms that help patients still secure access to cannabis while not having to necessarily come into close contact with potentially infected populations. And there you really saw two major reforms. Those reforms were curbside pickup, allowing patients to come to dispensary sites, stay in their cars, and secure access without necessarily having to directly interact with staff. Of course, caregivers were given those options as well. And then you also had delivery. Many states organized specific provisions related to curbside pickup and delivery. There were 27 states of the 33 that organized reforms. There were 27 that organized specific provisions allowing for curbside pickup and delivery. Now, it's an interesting phenomenon that occurred with the advent and addition of these programs, because many of these programs didn't exist in these states before, but many states took it upon themselves to ensure that patients stayed safe and implemented these emergency features. And we heard a lot from patients since we work with states on those reforms, and when we issued the 2020 patient survey that really informs a lot of the content of this report. We heard a lot from patients about the desire to hold on to and maintain those programs, which we'll talk a little bit more about later. Now, only 6 states had provisions like this in place prior to COVID, allowing for delivery and curbside pickup. Meanwhile, 5 states, Maine, Massachusetts, Michigan, New York, and Rhode Island, they all scored perfectly in this category. So huge props to those states for really working hard to ensure that patients maintain safe and legal access during COVID, also going above and beyond, really to keep those patients safe and make sure that they could get access even in their homes. I think something important to remember about those specific reforms is when you think about cannabis patients and access to medicine, the way we think about it at ASA really is ensuring that medical cannabis patients have the same parity in terms of their ability to access medicine as patients who are utilizing traditional pharmaceutical products. So that's really, I think, what we're striving for as we continue to do our work with states, is encouraging them to try to really build parity between those two models to the greatest extent possible. And certainly these emergency features did a lot to facilitate that. Next, we kind of hop into another segment in terms of the COVID emergency responses, and those related to ease of use and cost. A challenge a lot of patients have as they try to navigate these systems is the cost of the systems and the medicine themselves. We'll talk a little bit later in this presentation about one of the key findings of this year's report, which is the ongoing high cost of medicine to patients. There are a lot of programs that states can organize to try to chip away at that, but some of the things that states did during COVID really answered that call. States were good to try to put in place measures that allowed patients to either continue their existing enrollment for another year, sometimes longer, so that saves patients money by not having to constantly pay to re-enroll on an annual basis. Patients were also given the opportunity to use telehealth to interface with their doctors for evaluations for new enrollments, as well as for new patients. So there are a lot of great features in there that save patients money, both with respect to enrollments, but also with respect to doctor visits. Travel burdens can often be an issue for patients, so that saved them in that respect as well. So again, a huge round of applause for the states that organize these measures. We're really excited to see them, and certainly there's a lot of patient support for them. This slide really kind of illustrates those 3 program enhancements that we heard a lot from patients about how much they want to maintain them. ASA certainly we'll be continuing to move forward in recommending to states. You'll find a significant amount of dialogue in this year's report encouraging states to hold on to these programs. As I mentioned, these are key features that exist, as this slide demonstrates, for the traditional pharmaceutical market already. It's important for patients to be able to access medicine, whether it's prescription medicine or whether it's medical cannabis that has to move through a different system because of our federal and state conflict of laws. Either way, these are program features that are really critical that patients really need to maintain, and we encourage states to go ahead and hold on to them. Of the 47 states that have organized these legal access models, you have 11 of them that have comprehensive medical access as well as adult use access. But one of the key takeaways of this year's report that we really wanted to call out was the phenomenon of states kind of moving too quickly into pursuing adult use rather than shoring up their medical program. We're not saying that you can't do these things at the same time. What we are saying is that it's really important not to neglect the medical program while you pivot to and focus on adult use. As we dig into these, I think it's important to remember that some of the key issues that states are resolving before they move on to adult use really deal a lot with patient rights and patient legal protections. Again, without these things in place, you really run into a challenge where patients can face fines, can face jail time, can even potentially face loss of custody of their children without specific protections, legal protections put in place to allow for that. So that's what these couple of slides really kind of go over. As far as the kind of core issues that we're kind of chopping through here on the legal side, you've got employment, you've got driving protections, you've got housing and family law. These are all key issues that states need to address and ensure that they're in place for patients. Again, without these, without employment protections, patients are at risk of losing their jobs. Without driving protections, patients are at risk of losing their license. They're at risk of losing the places that they reside in if they live in subsidized housing. So these are all critical features that states need to organize. Otherwise, patients are essentially put at risk of both fines or jail time for simply participating in a state-sponsored medical health program. In terms of patient access, this is another huge one. As I mentioned, there are a number of reasons why this phenomenon can occur, whether it's arbitrary licensing caps that some states have in place. Delaware springs to mind on that one, where there's a specific set number of licensees that are permitted to operate wherever those kind of markets exist. It's really kind of a arbitrary licensing number that isn't necessarily grounded in reality in terms of the patient population that it needs to serve. So when we see those kinds of models, we're certainly encouraging states to really think critically about how they assign that number. In a lot of cases, it can be appropriate to simply remove those arbitrary caps to expand a sufficient number of retail access points. Again, without a legal market to patronize, patients are really left with the illegal market. I don't think any state lawmaker out there would recommend that pharmaceutical patients do the same and try to purchase their products on the illegal market. So it's really important that states organize functional access. Other models that can kind of contribute to this include vertical integration models that require a licensee to be a cultivator, manufacturer, and a retailer, as well as a distributor. That requires a tremendous amount of business know-how as well as a lot of capital to get a business going like that. So in a lot of cases, it's important for states to really kind of untangle those vertical integration models. They allow for greater competition in the space, which means more market participants, which really means more medical cannabis businesses to help patients, which in a lot of these markets, there just isn't a sufficient amount. And before we jump into this next one, I just want to say, states that pop out on that front, really, California, Massachusetts are two that immediately spring to mind, where you have this issue of these limited retail access points. Both with Massachusetts and California, it's an issue dealing with local control, which you see in a lot of other states as well, where local governments may have specific roles outlined in state constitutions, responsibilities often overseeing zoning and land use. And you see a lot of local governments who are worried about moving forward with these reforms, really using that responsibility to deny patient access. So we want to encourage states to try to move away from that, start working with your local governments, figuring out best ways to get more retail access points available for patients. Otherwise, again, the alternative is really to force patients to shop on the illegal market, which isn't good for public safety, public health, or the patient's health. With respect to another outstanding issue with testing, labeling, and supply, this is an issue that we continue to hear from patients about in our State of the State survey to patients every year. With testing, it's really important that states get that formula right. I know that states really aren't the go-to. It's really the federal government, which is where that policy area lay, and all the details around appropriate testing standards. But with respect to state models, it's really important that states really screen for the full array of heavy metals, pesticides, contaminants, and toxins that can be produced during the manufacturing process of specific medical cannabis treatments, as well as just the cultivation of flowers. So the testing requirements are very important. And it's also really important for states to require that labs screen for terpene profiles of cannabis products, as well as the full array of cannabis compounds associated with a cannabis product. So as a consumer, many cannabis patients are really forced to navigate their own journey in terms of what works for them, as states haven't really done an effective job in terms of giving states an understanding about which medicines might be more appropriate for certain conditions. And so with patients kind of left on their own to navigate this journey, it's really important that what we test for is information that patients can use, and that information ultimately appears on a label on the product. So patients can see that label, know how much CBD, CBN, CBG, THC, and other plant compounds exist in the product, as well as get a sense of, did this product clear lab testing? Is it safe for consumption? So those are really kind of the big takeaways from the scoring side of this, of things that states are leaving behind, that ASA really encourages states to work on before they move too quickly into adult use. With that, I'd like to turn it over to Andrew in our shop to talk a little bit about some of the highlights of this year's report.
Okay, thank you, Dustin. I have been running the PowerPoint here, so all the mistakes can be blamed on me. Here we go. So this is the new section. You've seen it a few times. Dustin mentioned it in regards to Florida and the grades, and Debbie mentioned it in regards to the new stuff she was excited about. So one question that always came up for me when I'm looking at a medical program in each state is what's the patient population it supports. It's a pretty important aspect of a medical program's function to see how many patients it's serving effectively. So I thought this is a good sample of a couple of states that could help a picture of a program simply through some numbers. These highlights can be found on every state's page. So by showing patient population as a percent of the total state population, we're able to compare the size and scope of efforts across multiple states. Like if we look at Oklahoma here, where we see the largest per capita population represented by medical cannabis patients, where some like 125,000 patients essentially make up over 8% of the population. That's the biggest chunk by far in any state. Maine comes in second in that category, just under 5% with 65,000 patients, excuse me. And comparing that to Illinois, a similar number, just above 120,000 patients, which barely makes 1% of the population, doesn't even scratch it. The number Illinois has is typically more of the average across the country. It's usually right around just below or just above 1%. So Maine and Oklahoma are actually kind of outliers. Another number I wanted to track was number of dispensaries across the state, how many access points per patient were available. And I think it's a good contrast to see in Texas here, in yellow, it's a CBD only state. They're one of the few that actually does track their patient population. But as we'll get into later, it's restrictive, these programs, and ultimately they're kind of failures. But you can see here, no retail access for patients, not a lot of representation. And that'll be a theme for the CBD only states. So another new section is the gold standard section, where I wanted to highlight the best of each sort of scoring category. So picked 5 of the highest scoring states, and just a quick run through of the reasons why. So we're going to start with Maine and Illinois here. Illinois led the pack for patient rights and civil protections. It's pretty typical for states, the ones we have in blue in this report, the adult use states, to score high in this category. In fact, you'll see that 4 out of 5 of these gold standards are adult use states. But the reason Illinois specifically scores so high in this category is that it also goes the extra mile in ensuring that medical patients won't be discriminated against in the workplace or by the police. And it is legislation specifically that helps medical patients in this regard. Moving on to the ease of navigation category, Maine's a great example because they recently did away with their qualifying conditions list, meaning that you don't have to meet the exact specific condition you might have to in another state. Your decision to start using medical cannabis is between you and your doctor, and that recommendation can be written just based upon that relationship and the trust you've built, and you don't have to fit a narrow category like you do in most other states. There's also a wide variety of caregivers available, a lot of access in Maine, very easy to use. I'm in Maine right now. I do have some experience with it. Next 2 categories here, we have Colorado and Oregon. So Oregon leads the pack in access to medicine. Everyone knows Oregon's famous for cheap cannabis. They made a policy out of almost too many growers, too many producers, and that's just beneficial for patients. It's definitely something we recommend, even if it's not necessarily the best for businesses. We're for patients. So functionality, Colorado led the pack. Colorado, it was one of the first states to go down the adult use path, and we've seen a lot of states that have gone down the adult use path sort of neglecting patients after the money shows up, pretty much. Colorado's one that made sure through co-locating medical and adult use dispensaries and allowing producers to produce for both medical and adult use under the same license, they made sure that the production for medical patients wouldn't fall behind in the face of adult use production. And the last gold standard and category is Maryland, which is the only perfect score in the entire report, 100 out of 100. Well, at least in our traditional categories. There were a few that scored perfect in the COVID category. But Maryland is also the only state out of the 5 that is a medical only state. But Maryland's product testing requirements are very strict. They test for 48 pesticides, 8 residual solvents, 9 microbiological biological impurities, 8 heavy metals, and a very complex profile of cannabinoids. If you've ever shopped in Maryland, you know that your cannabis has a tag, a label that's just as big as the packaging. It wouldn't even fit on there because they break it down so distinctly like that. So moving on now to something we've heard a few times referenced throughout this webinar is the high costs. And cost is one of the major barriers to patient access across the country. We see it repeatedly in our patient feedback survey, and I experience it myself when I shop at dispensaries in DC, especially. There are factors that go into the high costs. It's really about developing appropriate regulations to reduce overall costs. Ending vertical integration is a major one. And we also need to make sure that patients aren't getting hit too hard by the taxes that do wind up coming with adult use, and that they're not paying more than they were before a new program was put into place. One way we can also help costs for patients is to promote growth. Like I said, one thing, stop vertical integration, just in general, promote producers at all levels. If you want to have a small greenhouse with 500 plants, 200 plants, whatever, those licenses should be available. The Oregon model just proves that more producers is good for patients, ultimately cuts down cost. We also need to allow cultivation at home. Currently, only 17 of the 47 states allow for some form of home grow. This needs to be every state. I don't see any reason why it's not. Moving on now, one thing we have referenced before is how the CBD models have been pretty consistently failing patients. There are 14 of these models, so you've heard us referencing that there's 47 states with medical cannabis access. 33 of them have a true medical cannabis program. Whether or not they work, that's different. 14 of these states have CBD or low THC oil exclusive programs. Every one of them has received an F. The highest grade, just cracked 50, was Iowa, 50.2%. Here's Georgia's report card. Georgia, like Texas and Iowa, those are the only three that actually record their registered patients. And that's kind of a hallmark of these CBD only programs. They're loose with the registry. The requirements, the qualifications for you to get a card are narrow. Sometimes your legal protections are as flimsy as just the note from your doctor. Many states, Georgia included, don't actually have a way built into the law for you to obtain your CBD oil in state. You just have to get it from wherever, and they'll close their ears and shield their eyes and not ask where you got it, as long as you got it legitimately. All right, I'm going to hand it back over to Debbie now.
Thank you. Thanks so much, guys. So as you can see, this report really highlights that there is still significant work to be done across the states with medical cannabis programs in order for these programs to really meet the needs of all patients. ASA will be working directly with patients, doctors, scientists, lawmakers at the state and local levels in 2021 to fix a number of these issues outlined in this report. And we have quite a few resources on our website already that can be really helpful to you. We have fact sheets and one-pagers. We have examples of other functioning state models and associated legislative and regulatory language. Please, reach out to us if you need help with anything. We also have training and education programs, such as our patient-focused certification program, which is a training program for the industry. And and a certification program that certifies a company as being safe for patients, meaning that they are working safely and compliantly. We also have our Cannabis Care Certification Program, which is an educational program for patients and also includes CMEs, which are continuing medical education credits for doctors. So not just doctors, medical professionals, nurses, nurse practitioners, psychologists, psychiatrists, pharmacists. Please check out cannabiscarecertification.org for more information on that. We have a ton of information on our website for regulators, legislators, doctors, patients, caregivers, cannabis businesses, and helpful ways to improve their approach to medical cannabis to be more responsive to patient needs, as that is our priority, is patient needs. So you can also get engaged directly with ASA campaigns by becoming an ASA member or signing up to be a volunteer. ASA membership is as low as $35 a year. I think it's even lower for the student and veteran rate. So like I said, we cannot do anything without the support of our members. So thank you to all our members out there, and please sign up for membership if you're not a member. There are some benefits. If someone can put in the membership link over on the chat area, please go to that page to sign up. Beyond engaging in the state level in 2021, ASA will also be deeply involved in the federal advocacy and invites you to join our advocacy efforts as well. Beyond maintaining federal protections for state medical programs, ASA will also be advocating for important bills like our Office of Medical Cannabis Control, which is federal oversight of medical cannabis, and the MORE Act, legislation that will deschedule cannabis, establish a regulatory framework for federal cannabis oversight, and organize cannabis job training and criminal record expungement programs. But before we get there, we still have a lot of work to do to prepare for the 2020 general election. So ASA encourages you to get out and vote and elect lawmakers who actually care about patients and want to help patients. At all levels of government. Your vote for cannabis your vote for cannabis supportive lawmakers makes the passage of things possible, like federal reforms, state reforms that will reduce patient costs, make programs and medicine more accessible and affordable, and protect patients with comprehensive legal safeguards. And also local reforms that allow for much greater legal access to medicine for patients. As you can see, we have a campaign here. Every vote is a medical cannabis vote. Please go to safeaccessnow.org/vote to find information on how to vote, how to register to vote if you're not registered, where your polling location is, and much more information. And check back to that website in a few weeks, because we're hoping to update it with more information in the next few weeks to come. I just want to mention that this webinar will be available online for free for anyone. So if you weren't able to see the whole webinar, or if you know other people that weren't able to make it tonight, please make sure to let them know that it will be available on the ASA website. And now we're going to kick it over to some Q&A. And I will let Jeffrey. Jeffrey, do we have any questions to answer?
We do have a few questions.
Great. And feel free to add them to the chat as we go along, guys. Thanks.
Yeah, keep them coming, please. Something we had some questions about were people who agreed that the COVID protections were helpful. They found them to be improvements to their state's program. So what kind of advice would you give in terms of making sure those improvements are maintained?
Well, if I can jump in on this one, Jeff, this is Dustin. I think the first piece of advice I would offer is, as Debbie just mentioned, it's really important that you focus immediately on voting and organizing your voting plan, taking a look at from the federal level to your state representatives, to your local representatives. You can hop on your county registrar of voters website, take a look at specifically who these folks are, and do a little bit of your own homework to determine whether or not these members are dedicated or doing any specific work related to medical cannabis. I think that's a good starting point. After that, ASA will be very much engaged in encouraging states to hold on to specific COVID-related improvements by signing up to be a Safe Access Now volunteer or becoming a member. You'll receive information and updates about those campaigns. So I would definitely encourage you to do those things as well. I don't know if there are other thoughts from my colleagues on that.
That was good.
All right. We also had questions regarding we talked a little about federal reform, and with the MORE Act recently being delayed, what kind of chances do we have going forward for 2020 and 2021?
I think the answer to this question could be similar to the last one. Again, I think you've really got to take a look at preparing yourself to vote, preparing yourself for this election. Federal activity for this year, you'll see some activity in the lame duck, but I think, as you've already seen a preview of with the passage of Supreme Court Justice Ruth Bader Ginsburg, there's a lot of controversial issues that House and Senate chambers will be dealing with unrelated to cannabis. And so while there's certainly an interest from patients and dedicated advocates to try to push a vote, I think we're probably going to see a lot of this stuff move into 2021 and 2022 congressional session, where we'll have an opportunity to really start working with members anew on trying to push cannabis policy. But so much of what will be discussed in the 2021 legislative session in Congress among federal regulators in the administration of the White House is going to be a function of what happens in the elections this year. Obviously, you've got key things in place like leadership of the Senate. You saw legislation like the Safe Banking Act move through the House chamber last year, but is not going to be able to move into the Senate chamber because the Senate won't consider cannabis-related legislation. So these are big changes. These are things that you can do to directly influence the outcomes at the federal levels by getting engaged in the ballot box in November. That's going to steer a lot of what lawmakers consider in 2021.
Yeah, you covered it. Even if we got good news on the MORE Act in the House, there's almost 400 bills on Mitch McConnell's desk that are not going anywhere. That's going on the bottom of the pile. So, all in the ballot box.
All right. We also just got an interesting question about looking for an update on international cannabis policy, what the UN is up to, and any kind of updates on that.
I know that, sorry, go ahead, Debbie.
You go ahead.
I was gonna say, I know the UN, there are a number of countries who are UN members who have been doing a lot of work to try to influence UN policy on cannabis. You've got countries like Germany who had no production capability or mechanism prior really to 2018. And what we're very interested in moving forward with cannabis policy reforms, obviously they're very influential in the UN, in trying to build out a functional marketplace for patients as well as adult use consumers there. You have other countries, European countries, who've expressed interest, who are moving down that road. France is another big one. We've got a lot of interest, a lot of activity that's already occurred in Spain, but of course, Spain is a country that can't determine whether or not it wants to have a government. So we're waiting to see what kind of reforms can be produced under that model. But there's a lot of activity occurring in European countries as well as in South American countries. There's a lot of international activity occurring related to these reforms. And we expect the UN to keep moving forward in a positive and productive direction on medical cannabis and adult use cannabis reforms holistically, even if countries like the United States aren't getting on board.
Yeah, and I just wanted to add, I'm glad that you mentioned that and asked that question because, we don't talk about it a lot, but we do actually do a lot of international work. Even though our name is called Americans for Safe Access, we really want to make sure everyone in the world has safe access to this medicine. And so we have a program called IMCBC, the International Medical Cannabis Patients Coalition. It's a coalition of about, I think, 33 different patient organizations all across the country. And I was just talking about it this morning. We are, we do a lot of work. Last year, we had a training in Vienna for a bunch of patients from all around the world, train them how to talk to the media, how to advocate, how to talk to legislators, things like that. So we are doing a lot of international work, and if you're interested in helping with that, please reach out to us anytime, because we're always looking for volunteers. Now is probably not a good time to travel, but last year we were looking for patients to travel to Vienna, and we did find some thank you through our membership. Thank you.
All right. We had a question from someone who's using cannabis. They're a caregiver for a pediatric patient, and they're working in getting access at school and on the bus and stuff. So do you have any advice on that?
Stay tuned. We've been building a resource the past couple weeks to address just that, and it should be ready very soon, by next week, we suspect. We're looking at effective legislation in the past, and across the states that actually do have functioning pediatric care in schools, and we're just providing those as examples for parents who do want to change the rules in their states. But this is a problem we hear about a lot, and it's something that's very easy to fix and very obvious, and it goes back to cannabis being a Schedule I drug. It's the same bill made all those school zones that made this whole crazy loophole happen. So it's a problem as old as cannabis prohibition itself, really.
Yeah, and we are actually hosting another a symposium this Saturday, a neurological pediatric conditions symposium, which we have a whole panel where we're going to talk about pediatric issues within schools. So if someone can put the link in our chat box, there's also a free seminar this Saturday, the 26th, from noon to 6 p.m. Eastern time. It's going to be a really great symposium, and we're going to go over a lot of that information that Andrea was just talking about on Saturday. And then we'll post some of it as a blog as well afterwards.
Great. We had some questions around how the State of the States report can work as an advocacy tool, how we can use it to communicate with lawmakers and regulators. So could you expand on the sort of use of the State of the States report?
Absolutely. As Debbie mentioned in the introduction of the report, this is an annual report that really is designed to inform patients about what's going on in their state, but also lawmakers and regulators more specifically about what's missing in their programs. These programs were designed to meet patient needs, to serve patients, but many of them have challenges like we talked about in today's webinar that states need to fix. So we would certainly encourage you to use language from this document in your advocacy to states, as well as to go to our website, safeaccessnow.org, and take a look at, plug into your state chapter, and you can begin working with them on direct advocacy to your state lawmakers as well as your local lawmakers, and kind of plug into ACE's advocacy machine.
We also want to highlight with this report that even states with the best programs can keep improving. This year, I think we mentioned it during this webinar, but there are several states that wound up losing points overall and going down in grades because they didn't keep advancing the programs for patients. And it happens a lot in the states where adult use programs happen and they stop necessarily focusing on legislation and regulation for patients, and production starts gearing itself towards adult use.
Yeah, excellent point. I mean, just because a state received an A or a B this year doesn't mean they're going to continue to get a better grade next year. We've seen it happen now 2 years in a row where states have gotten lower grades than the year before. If they're not moving policy forward for patients, and then they're not doing anything, and that's going to be reflected in their grade.
All right, so we're just about finished here, but I do want to throw in one last question that'll be, and I want to hear from all of you. What was your biggest surprise in working on this report?
I think the biggest surprise is, we watch these states all year, and we're directly involved with state chapters and participating in state advocacy and are aware of kind of what's going on the ground. But it was surprising to me to see some of the totals in aggregate figures. You've got 47 states with some form of legal access model. Of course, 14 of those are CBD, only low THC. But, you still had 33 states across all of that organized these COVID reforms, which I thought was really powerful. And as we've mentioned extensively in the report and certainly in this webinar, holding on to those programs, maintaining them permanently is so important to Andrew and Debbie, both of their points about, these systems do still need reforms. Even if you've got a medical system that's been established for a couple of years, it doesn't mean that it's sufficiently serving patients. So it requires constant attention. And to see states, 33 states come forward with reforms when they had to abandon their legislative priorities generally across every policy area and still do something for patients, I thought that was pretty profound.
For me, since I pulled it up and went over to this slide, most shocking for me was Oklahoma. This was crazy. I mean, you don't believe it when you read it, but there's over 2,000 dispensaries in Oklahoma. Like when you apply for a license for a dispensary in Oklahoma, they also give one to your parents. I don't know how it works. It's unbelievable. I have no idea what's going on in Oklahoma.
Yeah, no, that's funny because I'm not kidding. The two things I was going to mention are the two things that Dustin and Andrew just said. Oklahoma was a big surprise for me too. That program just shot up quickly, which is great. It shows you that a good program can shoot up quickly. And also just, Andrew, Dustin, and I, we spent hours on the phone going over every single report card and every single grade and making sure everything was reflected properly after we did everything. And that was a really eye-opening experience. When we were doing that, we came up with all these themes that we were just like shocked at. And I do think for me, one of the biggest, I'm not that surprised, but I think I am disappointed that a lot of the states that have the adult use, just once the adult use comes in, it's like they don't even care about the medical cannabis program anymore. And they just start talking about adult use and the industry just starts growing for the adult use market. If you only are thinking of adult use, you're not thinking about all the pediatric patients out there. You're not thinking about all these patients who really need this medicine. They need it every day. Some of them need it for the rest of their lives. Some of them have really, conditions that they just rely on this medicine and they need the same type of medicine and they need it every single day. And so I think that I understand that adult use brings greater access. So I really appreciate that. But I do think that I really wish that states would just put a priority on patients and make sure that when the adult use does come into their state, that they prioritize patients with tax breaks or special days for patients or special things for patients. Maybe they get first in line, things like that. So I just wish that, states would realize that for patients.
That's why Colorado was a gold standard. I mean, they put their adult use program into place, but they made sure that patients were covered too. Patients have to pay a lower tax rate at the register. They still do have to pay some of the taxes that were put into place by adult use, but it's less than a regular consumer would be paying. And the fact that they co-located and allowed for co-production, I think definitely ensured that like what's about to happen in Michigan in November is not going to happen in Colorado. mean, we didn't even really talk about that today, but
Right. If a state isn't making special, putting patients as a priority, then they're doing something wrong. They definitely need to make sure that patients are paying less and are getting priority over the medicine that they need.
All right, I think we've got it, everybody. We should let everyone go for the night or afternoon, depending on where they are.
Thank you all for joining us. Our emails are right there if you need anything. And please feel free to reach out if you have questions about the report or anything else that we mentioned today. Please feel free to reach out and share this link with others so that, like I said, it'll be on our website in a few days, and we hope that you will share it with others. Bye.